visits. I welcome everybody, all my media friends, and sir, ma'am, and all those coming from Nagaland state. Sir Suresh will start first. So let's hear from him. Thank you.
As we all are aware that today in entire world we are observing World Day Against Drug Abuse. So for this year the theme is like break the cycle, stop organized crime, because all of we are know that this drug trafficking is not a business done by individual. It's in this trafficking there are so many groups are acting as organized groups. For this reason the United Nations have decided that we will have the theme for this year is like break the cycle, so that we will contain this drug trafficking. With respect to Nagaland, I will just like to share some basic information that we all are know that Nagaland is a proximity to the Golden Triangle, because we share almost 215 kilometer porous border with the Myanmar. So that, and the Golden Triangle is infamously known for drug trafficking. There are so many reports that after the Golden Quadrilateral, now the Golden Triangle is one of the most important drug trafficking areas, from where the most of the drug flowing through the other parts of the country as well as other countries also. For Nagaland, I would like to just share some information that since last year we have registered more than 270 cases as per NDPS Act, and we have apprehended more than 465 persons. But we know that there are some challenges while seizing these drugs. Like there are multiple routes, there are multiple ways to hide the concealment of the drugs, and there are so many porous borders, and so many players are acting in this entire drug trafficking network. On the line of prevention and demand reduction, Nagaland police is actively engaged in the awareness. As we are know that today also our CP Dimapur office and all district ANTF units, they are observing various awareness campaigns, and they have started some initiatives in the schools also under the Prahari Club, so that our children will be get aware about the drug abuse, as well as if someone in their family who are the victims of this drug abuse, they can make aware their family member also. Also, with the district administration under Nasha Mukt Bharat Abhiyan, the Nagaland police actively participating in prevention as well as awareness with related to illicit trafficking. And also, as we are all know that the most important thing is that the drug abuser, we need to rehab him, so that we are also, so if someone is from who is effective drug abuser, as per the NDPS Act there are provision, if that person goes for rehabilitation and successfully completes that rehab, then after getting that certificate the magistrate can release him as per the section 64A of NDPS Act 1985. So we are creating awareness on that front also. Those who are drug abuser, they can come out, go for effective rehabilitation, so that they will not be getting any legal loopholes of these things.
As our sir has said, today we are all observing the International Day Against Drug Abuse and Illicit Trafficking. I think this is a day, like at present, we should be we are quite proud that Nagaland, all the related departments are taking it very seriously, and all departments are taking this day as an important day to observe in their own respective areas and sectors. So this is a very important day for us, and we all know that our state is going forefront to address this problem. And sir has rightly said that our proximity to the Golden Triangle could also be one of the vulnerabilities that we are made to face. So I think the challenges are huge in front of us, but with the coordinated efforts from all the related agencies, I'm very sure we'll be able to overcome the challenges. We also understand the fact that drug abuse is part of the early civilization, and the challenges are huge. We need to work towards minimizing the effect, reducing the impact, and we also need to look towards elimination as well, which is a very big challenge in front of us. here it's not only the departments concerned whose role plays an important role. The role of civil society, and most importantly the media, plays a very important role in disseminating the informations rightly to the people. And when we talk about awareness, I think we also need to accept the fact that drug abuse needs to be looked at as biological, psychological, and health, socio-economic problems. And we also needs to see that it's not a moral failing on the part of the drug abuser. So these are lots of other factors that goes along with drug addiction, even in the state, as well as the challenges of addressing the supply, demand, and harm reductions. So widely, we also look at addressing drug abuse through three broad strategies, looking at supply reduction, demand reduction, and the harm reduction. So supply reduction basically is what Sir had highlighted also, to make sure that the inflow of illicit drugs are taken care of, are monitored and addressed. Demand reduction is to make sure that the initiation into drug use is reduced, or the time for initiation is the time for initiation is lengthened, in the way of informing the young people on time, involving school communities and families. I think that is very important. We should understand. We should be able to disseminate that need. And second, and the third is the harm reduction that we look at. So whilst on the way to recovery, and whilst on drug, we also don't want them to get into other harms. So harms is not only physical individual harm. Harm is to do with, they are vulnerable to crimes also, or they will be vulnerable to not being productive in the society, absenteeism towards work. This affects the economy of the state as well. So I think these are broad perspectives that we look at. I was told by our Sodhi Kumar that to highlight something on data, but unfortunately, as far as data is concerned, we don't have a kind of a data presentation as such, very specifically of very recent information. We at the Nagaland State AIDS Control Society work with a small population of drug users called injecting drug users, because of their vulnerability of getting the HIV infection. So we use the harm reduction approach to make sure that they don't get other infections. At the same time, we also do have facilities to link them up for treatment and recovery. So in that, through that initiative, we are able to get some numbers with us. So we do have the opiate substitution therapy program, which is a treatment therapy program, where we linked the identified injecting drug users to avail those services and then encourage them to get into recovery. So that is through that we are able to see a good impact in the state. I think in the initial two decades back, the HIV prevalence, since I'm from the AIDS control, I'll touch a little bit on the data. The HIV prevalence amongst injecting drug users was about 39% from the assessment, and now with the intervention we have been able to bring it down to 2%. And that is not a number to be complacent. We are still worried that not a single person should get the infection, and we all need to come together to make sure that they don't get the infection because of being into risky behaviors like injection also, and moreover with illicit drug use. So that is it. And there's one study, I think there was a write-up references this morning in the newspaper, Nagaland Post, regarding the magnitude of substance use in India 2019. That has also rightly highlighted. That was the only study of references that we are able to use, and it's us as well as the Ministry of Social Justice and Empowerment, the social welfare also often refers to that number to plan strategy. So that also we have also seen that our alcohol, those who are into alcohol use and into sedatives, and the percentage is also a little higher than the national average. Alcohol, we are a little lower than the national average. Ours is about 8% compared to national average of 14%. But when it comes to sedatives and opiates, we are second to one or two northeastern states here. So I think these are reasons where we also need to not only look at other preventive efforts, but also look at the individual as the center of our attention and concern, so that we are able to bring them out of the burden of drug addiction. At the same time, we also need to create an environment for the younger people to live a drug-free life, and so that they are directed, their skills are built up, they are directed to live a very productive and responsible citizens of our state.
As we all are aware that our Honorable Chief Minister have declared war against drug. After that, under the leadership of our DGP Shri Rupin Sharma sir, in the Nagaland police have constituted Anti-Narcotic Task Force, ANTF, which is headed by our Honorable ADGP Law and Order sir. Under that, we have in every district we have ANTF units, which is mostly headed by the additional SP. On these lines, we are going for seizure and arrest of the apprehended persons. So it's like that we have done more than 270 cases registered, but the number of persons arrested are more because of the main reason is that we are going after forward and backward linkages to break down that entire organized crime network who is involved in this drug trafficking. So it's like some person is carrying individual, but someone might have funded that activity, or someone is supplier, another person is receiver, so that the number of persons arrested are more because of that only. If you, it's like there are various kinds of drugs. Let me highlight that the major seizures happen in Nagaland is like we have the ganja, then opium, then heroin, here we popularly known as sunflower or sunflower, then the brown sugar, then yaba tablet and spaxoproximine tablet, and there are some other synthetic drugs also like crystal meth, and others are also manufactured drugs are also there. So like for every drugs we have different kind of prices in the market. So for example, if I want to share the latest, as we are all aware that in the last week only, our Honorable Home Minister also shared that within 1 week we have registered 3 cases. In that 3 cases, in one case we have seized almost around 6 kg of brown sugar, which is in the grey market area cost almost 1 crore per kg. Then again in another seizure we have seized more than 70 soap cases, and in another attempt also we have seized 50 soap cases, which is together containing more than 1.3 kilogram of heroin, which is normally in the grey market area cost around 7 crore per kg for heroin. So it's like more than 15 crore seizures we done within 1 week. So for this, if we calculate it's in the rupees, it's in crore. No, as such, though, we do not have any latest cases where our own personals are involved currently. Regarding government department also, currently we are not came across any cases where the government personnel are involved in trafficking of the drugs related things, especially within the Nagaland. So there is one also pertinent things we should address, that though Nagaland we have significant amount of persons who are the victims of this drug abuse, but Nagaland being a transit state, it is one of the transit state. From here the drugs go to the many parts of the country. The Nagaland police also help many states to intervene the consignments like which are going to the states like Punjab, Rajasthan, even in Karnataka also. So because of that also the flow of drug is very huge from the state of Nagaland.
Yeah, I think it's very difficult to actually say that one particular factor is the driving factor for that, because that prevalence, we'll also look at high-risk behaviors as one of them, but normally that state prevalence is generated from the pregnant women, who constitutes the representation of the general populations. And that's where that also we have been trying a lot, and efforts have been given, and I think we are seeing a very steady decline. It's not a steep decline, we are seeing a very steady decline. We encourage all pregnant women to come for institutional delivery. We encourage all pregnant women to come for the antenatal checkup in the public health facility. Until and unless people comes forward in the public health facility, it's very difficult to reach them with treatment on time. So if a person comes and if a pregnant woman especially is detected positive on time, early on, then they will be administered the treatment, which we call the antiretroviral treatment. So with that treatment, we also have seen that transmission to the unborn child is minimal or negligible. So I think on that line, the effort we have been doing really well in terms of the babies born out of those who had come to our system and those whose mother has been tested positive are remaining negative. Those who come very late, that means in the third trimester of the pregnancy, or those who just walk into the institution at labor and identified as HIV positive, these are the people where the babies gets the infection. So I think it's very important for us to disseminate the information down to the rural, to all our women, also to make sure that getting into the institutional facilities for regular checkup is very important in order to address this as well.
Nagaland is the transit state for other outside states, but how, from which states or locations are these drugs coming into Nagaland? Like we have Myanmar border, we have border with Manipur, so then are some other states also. Can you please?
Through our seizures in last 1.5 years, I can say that there are some patterns. Like there are some prominent routes which are used by these drug traffickers. Like mostly the drugs like heroin, we call it as a sunflower or sunflower. Then opium and ganja. It mostly enters to Nagaland via Manipur. From Manipur also we have so many routes. Like if we take examples, the one most important is like from Kusama check gate to Kohima, then it goes to Dimapur. Then we have another is like from Tadubi to Peren, then Jaluki, it goes to Dimapur, and from Dimapur to the rest of the country. Then from the Myanmar border side, we are from Myanmar border to Mon, to other parts of country also, and it comes to Nagaland also. Then from Longling to other in the parts of the state of the Nagaland, and also it goes down to Mokokchung and then to the rest of the country. Then we have found that another pattern is like there are some drugs, synthetic drugs, which are coming from side of Assam to the Nagaland also. So they are entering from Situpala check gate or Wamkin check gate from Assam side and entering into Nagaland, or from Dimapur to Kohima, and then from Kohima to other parts of the state like Phek, Longling, Kifre or Noklak district it is going. Then there is one pertinent issue I would like to highlight here, that for Nagaland police also, like if you take simple example of this, the highway which is going from Dimapur, Kohima to Manipur Impal, here on daily like more than 2000 vehicles are plying through this single route. For police also it's next to impossible to check each and every vehicle, which contains even bigger vehicles also. Through our surveillance, human intelligence, tech inputs, Nagaland police is trying our best to contain this menace, but to eliminate or to reduce it to negligence levels, the all society needs to come together, because until all peoples like civil society organizations, NGO, even the schools, the media persons and other government offices come together, we can't fight this drug menace incomplete. So that today, since this is all media persons came through you, I request all people of Nagaland, wherever you get any kind of information, please share with the Nagaland police. We keep your identity anonymous, and if even also like as per NDPS reward guidelines also, your identity will be kept anonymous, and you will be get rewarded also if the significant seizures happen. So I request all of you come together. If we come together, then and only then we will fight this menace. Unless it's very difficult for either police or health department or social justice department, if you work in silos, to fight this drug menace as a whole. So I request all of you to come together from this media channel also, share whatever informations you have. Like if you just suspect that some person is doing this thing, just share that. Police will then build through its own sources, try to find out that and seize that whatever contraband is flowing. From time to times we conduct surprise MVCP duties also, so that or whenever we have any pinpointed intelligence based information, then we conduct operations also. But as I have said earlier also, it's like very difficult to check each and every vehicle, because everyone is in hurry also, and we can't stop the traffic flow also, because it will create another problem. But we are trying our best through since our teams are also now well trained. If they found some suspicious behavior who is carrying drugs, they will get to know that. They observe something, then immediately stop that vehicle, and then they thoroughly check in presence of independent witness that vehicle and get proper seizure done. The most in recent seizure is this our highway only, the which is go from Dimapur, Kohima to Imphal side. Then most of the drugs which we have seized, if we want to take the closest point of contact, it is coming from the Senapati district. So it's like we have to understand this one thing in this drug trafficking. They works in nodes. They have organized kind of network. But just like if I want to say example, someone who is carrying from Myanmar border till Kangpokpi district, then from Kangpokpi to Senapati the other person will operate. That person don't know who is that Kangpokpi side. Then from Senapati till Kohima or Dimapur the another node will approach. They don't have any idea about who is in behind that. Then from Kohima or Dimapur to till Guwahati some other group will be operating. So it's very difficult sometimes to get, and the financial flow also happens through various means. Like sometimes they are using these mule accounts, and sometimes this finance happens through Hawala also. And sometimes the person who is carrying these drugs, he just gets some amounts like it's in 30,000, 40,000, but he don't know about what he has carrying, such a huge kind of consignment also. So because of these things, it's very difficult to crack down at the same time to entire network. But since last 2 years, Nagaland police is trying their hard. So we arrested accused from Manipur also. We even arrested accused like who are receiver in the other parts of the country. Like as I said earlier, from Rajasthan, Punjab. So we went there, we take down them. Also through financial investigations, we are trying to get recover like through which channels they are financing this drug trafficking network, and we are seizing their bank accounts if there is substantial amount of transactions is doing through that also. It is important for us also to know that what kind of profile is there. But when I also like recently started to monitor that, and surprisingly it's like very diverse kind of a profile I came across. Like some carrier, they are illiterate, they even not studied for single standard also, and some carrier they are graduate also. Some of the in one of the case I came across that the person who was carrying that drug, he is a very good athlete. He even represented at like zonal level kind of competitions also. So and even like we observed that even on gender basis also, there are women who are carrier, that pattern are also commonly observed. Though we haven't came across the woman who is substance abuser, but there are some women who were carrying this stuff. And if we take age group also, it is varying from like 18 years till 70, 75 years also in some cases. So in recent one case only, one of the accused, he was born in 1968. So we can just imagine that even that age group is also varying significantly. So it's like it is having impact on all kinds of age group, professions, we can say that, and even social structures also. Like if you go by the registration of cases, the higher number of registrations of cases happened in last 1.5 years, mostly in Dimapur and Kohima. Though since as I have discussed, like currently Nagaland police in its initiative of war against drugs, all our district units they are coming up, and that's why these seizures in the various districts also increasing, because they are taking efforts wherever these drug traffickers are trying to go. And since these drug traffickers are also like that, if we concentrate on one routes, they will try to take another routes. That's why we also see that these patterns of varying, like sometimes in some months there will be a high seizure on this highway, so they will start taking that route, then seizure will shift to these districts. These patterns will be continuously shifting, but majorly most of the cases are registered in Dimapur and Kohima only.
And that is regarding the trafficking, sir. So what about the abuse part? Which district is having the most number of abuse cases?
Regarding that abuse related parts, like I haven't have exact data because it's like not a police direct role, but we can see that the cases where the drug abuser, like the person who is involved in petty drug peddling also, and he himself is abuser also, that kind of cases we are found in the districts like Longling, Nokla, or in some parts of Mon also. So sometimes though we observe that since he himself is a drug abuser, to get some money for he's doing this peddling, and these drug traffickers are using them